welcome everyone to the Healthy Food Systems Priority Initiative call. And this is March 18th, and I'm really ecstatic because I don't think we've ever had 38, and we may hit 40 attendees today. So that is just really fantastic. And I'm Gail Hoxter with the County of Riverside Department of Public Health, and I am your chair of the Healthy Food Systems Initiative that is here under the Southern California Public Health Alliance. And with that, I want to kind of give you just a quick overview of the role that this initiative has been working on. The last year, our overall goal is to advance strategies to make healthy regional produced food accessible, affordable, and sustainable. And as I'm reading this, it will be in the minutes, but it is also on the Southern California Public Health Alliance webpage. So if you want to share this with someone, please send them to the website. This last year, we focused on best practices in institutional food purchasing and food procurement, and looking at from government agencies to schools to hospitals to private employers, and how to make local healthy food available within the food system. And with that, we developed a roadmap to healthy local food system, which is on the website, and I encourage you to check it out. It's really comprehensive, and all of us in different counties are in different stages. But this year, starting in 2014, our focus is for the Healthy Food Systems Initiative is bringing together professionals from environmental health, chronic disease, and food systems to work together to promote healthy food locally and access through collaboration and other aspects as to what do we need to do to make this work. So with that, I want to thank all of you for attending, and the Alliance counties, from being everywhere from Ventura, Santa Barbara, down to San Diego, and our two cities of Long Beach and Pasadena. So welcome to the call, and I want to go over, hopefully everyone has an agenda. And on the agenda are the desired meeting outcomes. And for today, we want to have updates we had a wonderful meeting Friday on the Alliance meeting on collaboration between chronic disease and environmental health. And then the other part of our meeting today is going to be conversations with Justin Malan, Executive Director of CCDEH, regarding the environmental health practices as it relates to food supply, safety, security, and sustainability. And how can we encourage communities access to healthy local food produced? So with that, I'm going to turn it over to Carla for some other updates.
Thank you so much, Gail. That was a great introduction. I'm going to turn it over to Mina.
Sorry, Carla, I think you faded out for a second there. Did you want me to go over the housekeeping items?
Yes, that'd be great.
Okay, this is Mina Brown from Public Health Alliance of Southern California. I echo Gail's welcome. I just wanted to remind you, like last time, we're going to mute everyone, and we would like you to speak when we ask for dialogue and discussion. So to do that, you can press *6, and then you can press *6 again to mute yourself. The presentation, in case you are having any technical issues with Start Meeting, the presentation is available on our website, which is phasocal.org. All the way on the right side of the blue banner, you can find EH Call 2, and you can download a PowerPoint of Justin's presentation. That's also where you can find information about our Healthy Food Systems Initiative that Gail was just talking about. And we do have at least 44 people on the call today, so we're going to skip introductions, but to suffice to say, we have folks from throughout Southern California, as well as involved environmental health folks from CCDEH joining us from Northern California, and welcome to all of you.
Great, thank you, Mina. So I'm going to go ahead and put everyone on mute. If you want to talk, you're going to need to dial *6. Here we go. Okay, so I think the next item on our agenda is to just do a quick debrief on our Alliance Leadership Council meeting that we had on the 14th. And I think we have Angelo Bellomo with Los Angeles Department of Public Health, Environmental Health Division on the line with us. And I don't know if you had any thoughts that you wanted to share about the meeting, Angelo. And remember, you have to dial *6 if you want to talk.
Sure. Can you hear me now, Carla?
Yes, thank you.
Okay. I'd be happy to just make a couple of quick remarks. I think this collaboration really came into focus last week during our meeting because we were actually able to really take the prior discussions that we've had and get into a little deeper area with it. But the collaboration is important for a number of reasons between environmental health and our partners in chronic disease prevention. I think that it's pretty evident to those of us working in environmental health that our goals are really very much aligned with public health goals. So when we hear our partners talk about bringing in healthy, affordable, and sustainable foods into local communities, we're thinking, yep, those should be part of our goals. I think intuitively, our conventional thinking in environmental health has really been focused on food safety, and there's ample reason for that. But we had a number of colleagues in environmental health attend the last two calls and the meeting last week, and it was very exciting because I think all of us are seeing that, yeah, food safety is important, but having foods that are sustainably grown, local, and healthy are also very important. We can line every street in America with fast food that's safe, but we absolutely do relate to the need for us to ensure that that food is healthy as well. So that is a public health goal, and it's one that many of us in environmental health, most of us, I think, really subscribe to. To be direct as I can on this, I think that our partners in chronic disease prevention that are part of the collaboration they're very eager in working with us in environmental health, but they also don't want to scare us away. So we're all sort of gingerly trying to figure out how we work together, and we really don't have anything concrete now, but we have discussed a number of ideas. And I think we're very fortunate today because our speaker, Justin Milan, is not only in charge of our idea factory within environmental health, but he's a very good synthesizer. So I think we're going to learn a lot from his discussion. And so there were a lot of points brought up last week. I think that our focus really was on how do we ensure healthier foods and more sustainable foods in our communities. There's a lot of other overlap and a lot of other common goals with regard to how we design and build our cities. But food and healthy food in particular seems to be an area where we really do have some very obvious shared goals, and an area that I think we're going to see a lot of joint work on and sharing and collaboration in the future. And I really can't think of much else to say, Carla, other than those very brief points. We're sort of at a very early stage in our collaboration, and we're getting to know what's important to both of our disciplines. And we know that we belong in the same room, and we need to be focused on these ideas, but we haven't come up with anything more concrete than that at this point.
Yeah, and I guess the only thing, thank you so much for that, and I definitely echo that. I agree. Our goals are aligned, and I think that what we're trying to figure out is, where do we go from here? And one of the great things I think that came out of our meeting on Friday was a list of some of the areas where we currently are working together or would like to work together more that we could use to structure some of our future conversations that we're planning to have through these calls. And so some of the areas that we heard about in the meeting were healthy restaurant certification programs, and we're hoping to do some peer sharing around that. It sounds like Los Angeles and San Bernardino both have programs where DEH and chronic disease collaborate to identify healthy, as well as safely produced food. And so that would be a topic for future discussion. School gardens and farm to fork in school settings was another hot topic that I think came up, and I think that's something that we're going to really kick off in this discussion today, and that we'll look forward to discussing in greater detail, maybe hearing some best practices from some of our partners in San Diego and others going forward. Another topic was supporting local food economies more generally, talking about direct marketing and farmers markets, the opportunities of food hubs, and how DEH and chronic disease can be involved in this at the ground level to make sure that our food economies work for producers and work for consumers that are safe across the board. And then, again, sort of supporting small and urban ag within our cities and facilitating safety and sustainability by providing some guidance and assistance regarding soil safety and possibly water access. Another potential area that we heard about from Los Angeles was sort of identifying hotspot communities where there's multiple challenges and collaborating between chronic disease and environmental health to deliver some innovative solutions in those environments. So we'll hopefully hear a bit more about some of the work that Los Angeles is planning to do around that. Mobile vending was another area of interest that we've heard about both from Los Angeles and I think from Riverside previously. And then just an overarching goal or question was really how we're going to finance this collaboration given the sort of traditional financial structure of DEH and cost recovery. How can we make it possible for more proactive work in some of these areas to take place? And so I think that's a large question, but hopefully one that we can continue to tackle in our discussion. So I didn't know if anyone had any other topics they'd like to add, if any of these looked particularly priority, but I think that, again, we're going to have a good kickoff today with Justin, and then we'll really look at focusing in on some of these topics in future calls. Were there any other thoughts on the meeting last Friday?
I think that covers it, Carla. Having Linda Rudolph at the meeting was also very helpful, but between Linda and Justin, I think we're going to see a lot more in the way of synthesis of these very general but very solid ideas that you've got up there on the slide.
Great. Well, I think at this point I will move it along because Justin's presentation looks really interesting. So I am going to go ahead and turn it back over to Gail if she's with us.
I'm with you. I'm ready to go. I want to say thank you, Angelo. I think you really summed everything up just wonderful. I think we have a year of a lot of opportunity. With that, I want to invite Justin Malan. Justin was born and raised in Cape Town, South Africa. He graduated from the University of Cape Town with a bachelor's degree in law and public administration and a master's degree in environmental studies. Justin and his wife sailed a route to the U.S. in their home-built sloop. They settled in California in 1986 and have been living in Carmichael outside of Sacramento ever since. So we're great we have you here in California, Justin. Justin has managed a large coastal resources grant program for the state. He served as a senior environmental consultant to the legislature for 4 years, and from 1994 to present has been the environmental consultant, serving as executive director to several associations, including the California Conference of Directors for Environmental Health and CCDEH. In this capacity, Justin has worked extensively with the California legislature, public interest groups, and state regulatory agencies, and has served on numerous statewide committees and task force dealing with a wide array of resource management and environmental health issues. Justin's environmental consulting and advocacy firm, EcoConsult, currently has a diverse group of green clients, including the U.S. Green Building Council of California, Environmental Health Administrators, StopWaste.org, Community Alliance with Family Farmers, Heal the Bay, Clean Tech Advocates, and the California Climate and Agricultural Network. So welcome, Justin. We're privileged to have you with us today.
Thank you so much. It was a great intro, and I'm going to jump right into it and just, again, just throw out some accolades to your group and everybody participating for pulling us together, because it's often groups like yours that act as the catalyst to get us really motivated and do what we know we should be doing. You have a fairly extensive PowerPoint there, so I'm going to run through it quite quickly. And I also wanted to just give 1 minute at the very end. I omitted to just reference a few bills that are already in the hopper this year that may be of interest to the group that are directly related to the very topics that we're talking about. Okay, next slide. We have spoken about what we call S3, and S3 is really taken from what a lot of people talk about, the triple bottom line. And there are lots of ways of talking about a triple bottom line. The one I love most is the simplest. Our triple bottom line is people, planet, and profit. And to entirely omit any one of those is just foolhardy. Okay, next one. So our triple bottom line is not only safe, as Angela said, but secure. And what we mean by security is not just only biosecurity, but access. So it's safe, accessible, and sustainable food. And there are probably 100 cartoons every week about some aspect of any one of those topics, either the lack of sustainability, the inadequate access to healthy food, and of course just the safety in its broadest context of the food that we do tend to eat here. Next. We don't have to remind you, but I think what we are recognizing is that just having safe food doesn't mean it's healthful food. And those little quips remind us so vividly how the most bizarre situation, and I don't know if these numbers are necessarily correct, but at the least 1 in 6 kids in the United States suffers from too much bad food, and 1 in 6 suffers from too little food in the first place. Next. So despite being a first world country, we have challenges. As you saw in my bio, I've become very, very engaged, not just because I'm a 300-year-old farmer from South Africa. Our family goes back to 1688. But just having been in California, the food and bread basket of the nation, I've realized we have this sort of fascinating juxtaposition where we are so fascinated now, fortunately, with the food that we're eating, but at the same time, all around us, we are propagating totally unsustainable practices. We also have some very, very serious challenges with, if not just the genetic modification, but certainly things like the antibiotics in the food that we grow. Next. So you're all aware of these issues. And I think one of the challenges that we find is that quite often regulators, whether it's at our local level, state level, or at the federal level, we tend to deregulate. And I think one of the lessons that we're hoping to learn is that we cannot afford to deregulate. We need to re-regulate. We need to regulate more smartly, if that's a correct term. We have to be smarter at the way we regulate people's activities and provide them with not only the justification and an explanation, but also the opportunity of assuming personal responsibility by still having some sideboards and a safety net that is absolutely imperative. And I think we've tried to follow that logic, next slide, as we move towards recrafting our food regulations in California. I mentioned that we now are dubbing much of our focus on S3, and we've already had 3 highly successful conferences on that, and each conference picks up a little bit more steam. And those conferences have been the catalyst for the new dialogue, at the very least, and hopefully for many more people, but at the very least for those sanitarians, 800 or 900 or even 1,000 sanitarians that are involved in food safety, for them to look a little bit outside the box. And at the same time, as we challenge ourselves to look outside the clipboard, we challenge the foodies to look inside the box and to, reject total anarchy and realize that there are reasons for some of the safeguards that we have in place in our food codes. Next. So I won't go through these in too much detail because I think it's valuable to have discussion. But these are some of the questions that we've asked ourselves and re-asked ourselves at each of the conferences. Is it important to try and pursue this? We still retain our public health focus. We're not abdicating that responsibility or role, but we keep on asking ourselves, as Angelo did in the beginning, what's the point of having food that's highly sanitized if the sanitizer themselves do more harm than the few bugs that they kill? What are the most pressing challenges? How should we approach this? Can we approach it within the constraints of our legislative authority? Do we have to get new legislative authority? And frankly, and a very, very legitimate question that, in all our zest and enthusiasm, we have to ask ourselves all the time is it reasonable for environmental health to be stretched too thin to allow for this mission creep to eventually subsume more and more of their time, and they may actually find themselves giving up or having to give up on some of the core functions. Next. As you all know, in the past half a dozen years, there have been a lot of initiatives from international level all the way down to the local level and to the regional and community level, which is in some respects the most exciting. But we have seen a huge amount of interest, I won't say starting with the Food Modernization Act, because clearly that's responding to something. But even before then, when we go back to the leafy greens and we go back to the recalls that are 10, 15 years ago, and how we've adjusted to that, and how we've, in some cases, ratcheted up our laws, that they are too taut now. There's little room for latitude. There's little room for ensuring that we are advancing accessibility and sustainability. So some of these things are not necessarily working in synergy. They can even be in conflict. So the Speaker and other people have been involved in AB 581, and I know you heavily involved in that. We would just talk about sort of access laws and initiatives and efforts. The foodie movement, not starting with, but made fairly high profile from San Francisco with their 50 and 100-mile food shed idea and local food movement. We had a rather traumatic year a couple of years ago when the legislature here legalized or legitimized cottage food, which has been a taboo in the public health community for many, many years, probably 2 centuries. I mean, one of the most basic public health premises for food safety has been, we don't sell food that we cook in our family kitchen to the general public. And along with all of this, we've seen, not only from the food safety but from the commodity perspective, we've seen CDFA and other ag groups being forced to loosen up some of their, what I really call the commodity controls. And direct ag marketing is just that. It relaxes some of the standard packaging, labeling laws that have homogenized and homogenizes, I don't mean it to be low in that sense, but it has standardized the way we distribute and market California products. Next. So the broader public health, or what we call environmental public health community, there are a lot of things that are said challenge us as to how far we can go in terms of the mission and working on it. And we've had lots and lots of discussions over the last 4 or 5 years about radiation and GMO, and generally CCDEH hasn't got very heavily involved that type of thing. We haven't really got too terribly engaged in healthy lifestyles. We support it in our local communities, and we haven't even got down to the nitty-gritty of these so-called clean farms, which many of you know that after the leafy green outbreak back in Salinas and Monterey a dozen years ago, we've got some of the very, very big growers and brokers, your Doles and Monsantos and others, that basically have been insisting on a sterilized farm environment where all the hedgerows and the cover crops and things are just stripped clear, and you've got almost bare, quote-unquote, clean dirt, and these clean farms that can't harbor any rodents or any animals that can poop on the lettuces. Well, that has a real mixed blessing, if there is any blessing to it, because you totally destroy the natural environment. And, unless you're in hydroponics, farms need dirt, and dirt isn't sterile, and it shouldn't be sterile, because the function of dirt is to propagate and support life of all forms. So we have these tremendous juxtaposed conflicts and interest, and we want the so-called safe food, but at the same time we want to ensure that our farming institutions and systems and earth, etc., can be sustained. So I mentioned the risk-based management, the idea of not treating all food the same, all volumes of food the same, all types of food the same. And we started to grapple, particularly when we were challenged with the cottage food law, we started to grapple with the notion of, well, where is the appropriate level of government oversight going to be drawn? Is there personal responsibility, and what is that personal responsibility? And, I'll touch on things like raw milk, cottage food, the labeling, all these things. So the regulatory consistency has been the challenge, because there are some jurisdictions, as you well know, that have the political and socio-cultural interest in broadening the food choices and access, others that may be tighter, more restrictive. And to the extent that you've got at least 62 environmental health departments with a pretty diverse population, it's difficult to get regulatory consistency. But, Mark Twain said consistency is the hobgoblin of an idle mind. If all we are cared about is consistency, we'll be living in a hell of a boring world. So regulatory consistency per se isn't an end in of itself, but it's a tool, or it's a consideration as we look at ways of best managing and best regulating this important public trust obligation that we have. Next. So we'll go through these really quickly, and these slides I threw them in because we used them in 2 of the 3 conferences, and we were looking at what are the implementation changes that we have to do, running down from international down to local level. Next. That's focusing on food safety. The same thing with food access. What are the things that are getting in the way? And we felt for the S3 conferences that we have to identify those obstacles. And until we identify those obstacles, we can't really determine what our appropriate role is, or what the best bang for the buck that we can add to the debate. Next. So the same for all S3s, we ask the same questions. What are the laws, and what's the implementation, and what's holding us up there? Next. So the laws and regulations, we've done a fairly good job, but as you can imagine, it's a huge undertaking to understand from Codex Alimentarius all the way at the European community level, all the way down to our local ordinances. But at least for us, in our more limited sphere, we've had to understand what the state, federal, and local laws are that govern what we're trying to do. Next. So what we found is that we have a number of regulatory gaps, and because we are regulators, because we work within the law to actually enforce or implement the law, it makes sense that once you've got your general motive and goal is to drill down and look at what the laws and regulations are. Next. So we've spent some time trying to analyze some of the things, and we've seen that some of the laws are an ass. Some of the laws are being created in such a way that years later they simply don't work. So where we've got incentives and disincentives just because we call something a particular thing, we find that we incentivize the things that we may not want to incentivize and disincentivize those that we may do. Next. The whole notion of local and fresh is something that we've also had to grapple with in environmental health. And what we have done in the past couple of years is we've looked at trying to promote, starting from the local level, trying to promote safe, secure, and sustainable food. And it's dovetailed really nicely with the sort of local foodie, farm-to-fork movement. Next. We spent a little over a year participating, a number of us for CCDEH, participating in a working group that the Department of Food and Ag put together a year and a half ago. And we explored all sorts of avenues of direct marketing. There were two parallel groups. One was focused almost exclusively on dairy herds and raw milk. The other one was looking at how to actually support and stimulate what we call direct marketing. And the direct marketing is a really interesting notion because it ties quite well with what we use under CalCode, the retail food law, as direct marketing versus indirect, so the retail versus wholesale. And there's a fairly sort of close correlation between wholesale and indirect and retail and direct marketing. Next. So the first challenge for us in trying to stimulate access to healthy foods where we had control of it was to try to figure out what was really one of the major obstacles. And I wouldn't call it an obstacle per se, but the kingpin in much of what we do in implementing the retail food law is what we call the approved source. And it's a very, very simple statement of law, and that is you cannot sell something that's not an approved source to the general public. And if you're a retail food facility, and even if you're not, in most cases, you still have to ensure that the source of your food has been approved by someone. The challenge for that is that we have been living, ever since we've been applying that term or that concept, we've been living in a huge gray area. And we actually do not have the vast majority of our food, whether it comes from a 10,000 hectare farm or a backyard, but the vast majority of our food is not formally approved. Much of the food that is processed goes through some type of federal, state, or in some cases local approval, the permitting process. But if you grow a lettuce or if you grow a tomato, whether you're a farmer or a backyard gardener, in many cases you haven't had to have anybody look over your shoulder to make sure that it's approved. So we have an absence of a definition of some core terms like a farm. Under CDFA law, a farm, they've got 3 or 4 different definitions of what a farm is. We don't really know what a registered grower is. We don't know what a garden is. Until last year, we didn't know what a CSA, which is a misnomer really, but we call the veggie box delivery services community-supported agriculture. Which really is a term that comes from the Northeast, and that's where you did have people, town people actually supporting the agriculturalists, the farmers in the area, by giving them money up front in exchange for a share of their bounty later in the year. So I mentioned the retail. We mentioned the general public because CalCode's littered with exemptions to general public, but we had to look essentially at that being as the litmus test, is if we are allowing somebody to give, sell, donate, barter with the quote-unquote general public as opposed to a member of a club or a fraternity or something like that, then that's really where our food laws kick in. And then, of course, we had the Food Safety Modernization Act, which, although it exempted $500,000 or less farms, with sales of $500,000 or less, it still is very, very influential for the large growers, and it's pending, some type of regulations pending for those smaller farmers. Next. So when we looked at things, we saw over the years that we've been working with CalCode, we do actually have good coverage of off-farm processing, so whether that's federal, state, or in some cases local permits. So that's if outside of the cottage food, but if you're going to process food that's potentially hazardous and it's going to be sold to the general public, we pretty much got that covered at one or other level of government. The retail field stands and farm stands are covered under CalCode. So those we felt we didn't really have to scrutinize too closely over the years. We've tweaked with those. As to the certified farmers markets, that we 15 years or so ago, we actually worked on substantive legislation that now allows a farmer's market to have one central permit issued to the market manager, and all the vendors and stalls within that circumscribed area would fall under that one permit. And we've established a fairly well spelled out requirements for those farmers markets. So generally the farmers markets are well handled. We struggled, as I mentioned, with the cottage food, but let's just go to the next slide. But there were areas, again, that we mentioned, the approved source, the CSAs or veggie boxes. What about the gardens? When is a garden a garden? When is a garden a farm? When is a garden exclusively for private use or public use? Off-farm roadside vendors. These are many issues that we struggled with the direct marketing. So you produce your food on your farm, but you go off and you might bring other commodities in, other produce in, and you want to sell it from a store not on your farm. The law doesn't specifically allow for that in many cases. Adjacent to certified farmers market, if you're not under that umbrella. And then raw milk dairies was a sort of standalone issue. Next one. I want to ramp it up a little bit here. So what we had considered is that all food approved by CDFA or Department of Pesticide Registration would really be all sort of agricultural production. And what we thought would be the best way to handle your small operators, both the veggie boxes and now in AB 1990, your urban production, was to follow best management practices. Next one. So this is generally the way we approached it. The AB 1616 was, to say thrust on us is probably a little harsh, but it wasn't sponsored by us. It was offered in the legislature, and we had to make the most of it. I may be a little bit more positive than some of the directors, but I think generally, after a lot of wrangling, we have kind of made it work, and we put some sideboards in it that I think are really, really important sideboards. Those sideboards protect us. They ensure that there's a distinction between direct and indirect. There is a rather arbitrary sales cap, so it stays to be a sort of micro enterprise, a small enterprise, and we don't have large facilities operating under private homes. And the one very troubling issue that we weren't successful in stopping, and local government in general wasn't successful, and that is preempting locals. And we touch upon that in the next in the bill 224 and 1919, because being local environmental health, we do honor and respect the prerogative of local governments to regulate land use and zoning and business practices in their jurisdiction. So that was one part of the battle that I suppose we could say we lost, and hopefully we don't have any situations where local governments are unable to reasonably control out-of-hand cottage food operations. The second piece that we felt needed to be fixed are these CSAs, and they were in the sort of gray area. Some local jurisdictions were looking at them, but they were neither fish nor fowl. They weren't really just full-on operations, ag operations that CDFA would look at, but they also were distribution, they were food handling, etc. So we worked with a couple of groups last year on AB 224, and essentially what we did is we just set some parameters down and said, if you're going to be a veggie box, and we describe what a CSA is, if you're going to just distribute uncut fruit and veg and raw eggs, then there's going to be the lowest tier of oversight. You have to be registered with CDFA, but you'll have to follow best management practices. If you add any of these value-added products, no matter what they were before, from now on, we're going to dovetail with AB 1616 because we now have a law in place dealing with non-potentially hazardous food, and we're going to require you, if you're going to put mustard in your veggie box or salted nuts or whatever the case is, you're going to have to get a cottage food permit if you don't have a full processing permit. And then finally, if you have any potentially hazardous food, if you have meats or something, you need a full permit except for one exemption under USDA. Next one. So I'm going to go to, so those are the, I forgot the slide. So those essentially were the issues that we had. The potentially hazardous food one, I think the exemption was, we got a rather bizarre exemption for rabbits and chickens. So what we did is we required US CDFA, Food and Ag, to establish more rigorous best management practices for the handling of those under the AB 224. And then the raw milk, if you're interested, we can get back to that. But we have worked for the past 18 months to 2 years on tightening that down to the point that I know that some folks in the public health community are still anxious about it. But with our involvement and the involvement of a lot of responsible small farmers, the Yamada bill, which deals with that, we're not sponsoring it. We may not even take a formal position on it. But the Yamada bill limits raw milk sales only to on-site sales if they're not fully certified by CDFA. So the raw milk will be limited to 3 cows, 12 goats or sheep, and it will only be on sale, on-farm sales. So you'd have to hike or bike or walk or drive to the farm to get that raw milk. Next one. So finally, the AB 1990 is the bill that we're working on this year. What we are trying to do is to get some certainty into the sort of gray area, this gray regulatory area. We have a couple of jurisdictions, Sonoma, San Diego, Berkeley, and a few others that are working on it that have different sort of levels of regulation. San Diego specifically just requires them to do a voluntary program, which is a bit of an oxymoron. But for them to do it, if they sign up, then they don't have to get a permit per se. And this is much of what we're proposing in AB 1919. Rich Gordon is a great author. He's used to be the head of CSAC, the Counties Association. So he does very much respect county authority, but at the same time he sees the value of trying to come up with a regulatory framework that encourages, promotes this type of activity, but still keeps it safe. And our idea here is that we will provide a definition of what a small garden is, an urban plot, whatever the case is, and you would be allowed to sell to the public if you followed the GAPS, which is the ag term for best management practices, good agricultural practices, or best management practices, and this is direct marketing only, except for one situation where it's a restaurant, and under current law, AB 2168 allows for restaurants to buy from the growers and then resell it. It strictly speaking is indirect or wholesale sales, but there's that exemption for restaurants because they want to buy from directly from the grower. So that's the sort of structure of AB 1990. As I say, the whole purpose is to promote urban gardens, but also to have a check, and that is that they need to follow these best management practices. We also write in very explicitly, even though they don't get a permit, we write in very explicitly that if through the traceback mechanism, which is a label on the product, if through the traceback mechanism we are in response to a complaint or a recall or an outbreak, we can go down to the farm, to the plot, to where the food is grown, and we can exercise the authority we have under Cal Code to stop the production, stop the sale, embargo, and destroy if necessary. So that's what we have with 1990. Next one. So I've touched a number of these on these issues. We've got a couple of things that we still have to figure out exactly what's going to be in the best management practices. CCDEH has been working very, very closely with a lot of its partners, the Cal Recycle, CDFA, in trying to develop those. We hope to be able to get those best management practices adopted fairly soon, before, preferably before January the 1st next year, when this bill kicks in. And our idea is that even though the bill currently has a provision that locals can be more protective, we may be able to remove that language if we feel that we have a bulletproof process for allowing locally grown, homegrown fruit and veg to be sold to the public. So I think if you go to the last slide, it says it itself. So we should have a few minutes for questions. I wanted to just alert you to the fact, if you're not tracking legislation, we have nearly 30 bills, and very, very quickly I want to highlight a few because I believe they're very germane to what we're dealing with. We have the raw milk bill, Yamada, and I can forward this on to folks, and that's AB 2505. I touched on the raw milk. It's, as I say, I don't think the public health community is necessarily comfortable with it yet. I don't even know if the farmers are comfortable, but it's one approach to dealing with providing people access to raw milk if, for whatever reason, they feel they would like to drink unpasteurized milk. And there's that question of public versus private responsibility. We want to ensure that people are very, very aware that this is not pasteurized. Under certain circumstances, it may not be safe. But on the other hand, some people may wish to have access to a product that hasn't been pasteurized. And there are safeguards to ensure that they don't inadvertently get it. Sugary drinks, I'm sure you've heard about that, SB 1000 by another great author, Senator Bill Monning. And we're struggling with that, quite honestly, with CCDEH as to how proactive we can be in trying to help curtail the distribution and the sale of these rather insidious drinks. Anecdotal mention of what I think of them, but I think many of you share that concern about these drinks, particularly being distributed amongst our youngsters. And then we have two antibiotic bills that are also very, very interesting from a public health perspective. Malan's bill is AB 1437, and Hill's bill is SB 835. And both of them, one is stronger than the other from a certain perspective. Malan's bill precludes more than Hill's does. But essentially what they're saying is that antibiotics that are routinely used in animal husbandry in order to stimulate growth should not be allowed. FDA has a rule on that. This would codify, in some case, strengthen that FDA rule. But it's a core issue because we are seeing side effects of our animal husbandry, and we need to get a handle on whether it's a GMO or antibiotics. We need to know that people know what's happening to the food that's being produced and what we put in our body. So I'm going to leave it there. We do have another ESRI conference coming up in a little over a year's time, and this time it will be hosted by the County of Sacramento, the self-proclaimed farm-to-fork capital of the world. Thank you.
Thank you so much for that presentation, Justin. And I just wanted to open the floor to questions. Does anyone have follow-up questions? It's a lot of content to process.
Yeah, sorry I had to run through it. I wanted to make sure you folks had some of that backdrop because I think it's important to know that we've been sort of incrementally moving in this direction.
That was just great. And I think that, getting the background on these bills will really help us as we sort of, identify where we're going next. I guess one question that I initially had, and this is Carla Blackmar, about the sort of understanding what's going on with 1990, is when you're doing this self-certification and it's sort of directed in this sort of sales paradigm, does that address the concerns about maybe a farm to cafeteria or a garden to cafeteria approach for schools?
Yes, we're trying to, with the author's office and with the various committees here, we're trying to figure out whether we should be very explicit and write definitions for all of those, like a school cafeteria and exactly what that means and what a micro garden is and what a victory garden and a culinary garden. Right now we've got a more expansive open-ended term, but it would include a school garden. But there's actually, at this time, the proposal is that there isn't actually a written self-certification because environmental health was nervous to assume this responsibility as another program, and the Ag Commissioners didn't want it, and CDFA didn't want it, and to do this program would have to charge money. Somebody would have to be paid to even process the self-certification. So at this point, we are pointing people to those best management practices, and whether you're a culinary garden or a school garden using that food in a cafeteria, you would be then fall under this, and you'd have to follow those best management practices. And the local environmental health in a routine inspection or on a complaint inspection can follow up and ensure that you're doing it.
That's great. That answers my question. And I guess the only other follow-up I had to that was there was some mention of label tracking with regards to...
So one of the core functions, and it's we've done it in the cottage food, we've done it in CSA, we're doing it in this. We'll probably, if we have any insight into the raw milk bill, one of the things that our folks have been insisted upon, and I think it's a very, very sound public health argument, and that is traceability. If we are going to, and you use this term really loosely, cut people a little bit of slack, what you do want to be able to do is to respond as quickly and efficiently as possible and to stop any harm if there is harm being done. We presume that there won't be, but if there is an outbreak, then we want to know exactly where that product comes from and be able to trace it back to the farm or to the urban garden or to the cottage food operation or to the CSA box handler, packer, and be able to stop the distribution of bad food. So all of the bills, legislation, sort of activities that we've been talking about, we've been involved in, that is a core element, and that is traceability.
And I think we would be interested in maybe in a future point talking about the mechanics of how that works and learning more about that. We only have 2 minutes left. Are there any other brief questions before we close? And remember, if you want to talk, you need to press *6.
I'll put everybody to sleep. Sorry, guys.
I just hope that the mechanics of this call haven't silenced.
Carla, this is Angelo, and I just wanted to say excellent talk as usual, Justin. Listen, one thing you had mentioned that before we can identify an appropriate role for us, we have to ask ourselves a couple of preliminary questions, and one of them that I'm most interested in is where, when we look at our shared goals with others in public health, where do we get in the way? And if we, knowing that our food safety requirements are essential, but knowing where we might get in the way of some of the goals that we share would be a good place for us to identify opportunities where we could work to eliminate those barriers where we together believe they're unnecessary or maybe overly burdensome. Do some obvious ones come to you, Justin, come to your mind as to where we might be able to focus so that we're focused on the most important things initially?
Right, exactly, and I think we've done that. Starting with the cottage food, each of these initiatives illustrates how we have tried to re-regulate. I don't like the word deregulate. Re-regulate. So instead of having a full facility permit, we now have a registration. Or instead of having a registration, we have self-certification. And the tiering of regulation should be commensurate with the public health risk. And the public health risk is a function of the product, the food itself, whether it's hazardous or non-potentially hazardous, and to a large extent the scale. We don't want anybody to be sick. But if I have got a pomegranate tree and I make 3 neighbors sick, it's different to having a Tyson chicken factory and you make, 5% of the entire United States sick when you have an outbreak. So it is commensurate with the public health risk. And I think requiring a full permit for an urban gardener would kind of be over the top. That's the most obvious. Even a CSA, where they're just boxing uncut fruit and veg, it would be very, very difficult for us to impose the same type of strictures that we have under Cal Code with smooth walls and stainless steel 3-compartment sink and hot and cold running water and all that for somebody that's literally taking fruit out of a large agricultural bin and putting it into a cardboard box and shipping it off to one of their customers.
And that's great. I think that gives us fodder for future conversation. And I think I just want to wrap it up here since we're at our time. And again, thank you so much, Justin, Milan, and all of the work you did for this presentation. That was excellent. And to our partners at CCDEH. And I just wanted to let you know that we're planning our next call on April 15th from 2 to 3 p.m. The topic has not yet been determined, but we have a lot to discuss and work from. And I just want to thank you all for attending.
Thanks, folks.
Thank you.